Please, everyone pledge allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Is there a motion to adopt the agenda as presented? Wrong. Oh, so moved.
Give me 1 second. Hold on. Okay, Dr. Firster.
Jack Simons.
Thank you.
Roll call, please.
Dr. Firster,
Yes.
Mr. Simon,
Yes.
Mr. Dubus.
Yes.
Mrs. Salpata. Yes. Mr. Messerschmidt.
Yes. Is there a motion to approve the minutes of the June 25th meeting?
So moved.
Is there a second? Second. Are there any additions or corrections? If not, roll call.
Mr. Dubus.
Yes.
Dr. Firster,
Yes.
Mrs. Salpata. Abstain. Mr. Simon.
Yes.
Mr. Messerschmidt.
Yes. Next on the agenda, Health Commissioner's report.
Thank you, Mr. Chairman. You have my written report. Couple of things I want to add. First is that I spoke to our medical director, and he's not going to be able to be here today. He's a little under the weather, so if there's anything that we need of him, he did say that we can reach him by phone. So if there's any questions you do have for him, just let me know and I'll call him and get him on the phone. Second item that I wanted to bring to your attention is that I was recently informed, and I want the board to be aware of this, is that effective September 30th of this year, Ohio Revised Code Section 9.64 is going to require that each local government entity, which we are, would need to implement a basic cybersecurity program. And the program should include annual cybersecurity training for all employees, which we already do that. A cyber incident response plan has to be developed, practices to assess and remediate cyber risks, and reporting of cyber incidences to the Ohio Cyber Integration Center and the Ohio Auditor of State. So I've discussed these requirements with our IT specialist, Dan Dean, and he is working with our county IT to comply with this new law. So I'll just keep you posted as that comes, because that's right around the corner. And then the final thing, as you may recall, at the June meeting, that the board did say, allow me to hire into the environmental division. And I have our new employee here, our new sanitarian in training is Steve Gerberry. If Steve, if you could stand up. So Steve, it's been here about a month now, if I'm not mistaken, and he's going to be working primarily in the home sewage program under Chris's supervision. So the board wants to welcome Steve. We certainly do.
It's dicey, but yeah, I think it'll be fine.
Okay.
We needed around here another bald guy. That's right, yeah. We're taking over.
Yes. Thank you. Welcome aboard.
Thank you everyone.
Does he have to be released to go to work now? I mean, I don't want to have.
Yeah.
To sit there all day.
Nice seeing everyone.
Kind of a crappy job.
Yeah.
That's all I have. I could take any questions at this time.
Any questions? If there's no questions, there a motion to accept the report as presented.
So moved.
Second. Dr. Firster. Roll call, please.
Mrs. Salpata. Yes. Dr. Firster.
Yes.
Mr. Dubus.
Yes.
Mr. Simon.
Yes.
Mr. Messerschmidt.
Yes. The next item is the Director of Nursing report.
Thank you, Mr. Chairman. You have my written report. I will now take any questions at this time.
None on the seen it, so we don't have any questions. Do we have any questions, Secretary? Is there something in here that you read before you gave it to us that we should be aware?
No, no questions. It's perfect. It's good. I'd call for the vote. I mean, the motion.
Anything in the report that you'd like to point out to us?
No.
Is there a motion to accept the report as presented? Is that a motion? Okay, I didn't know if that was a question or a motion. Second by Mr. Simons. Roll call, please.
Dr. Firster,
Yes.
Mr. Simon,
Yes.
Mr. Dubus,
Yes.
Mrs. Salapata,
Yes.
Mr. Messersmith.
Yes. The next one is the environmental health report.
Yeah, thank you. So I provided a written report. One thing I would add is that until Steve came on, we had some people on sick leave. We were extremely short-handed, so it was good to actually get Steve in here. We were stretched pretty thin. Some scholars will most likely tell you, hopefully we handled it well, but the addition of Steve, and he's doing well. He's learning on the job fairly quickly, so he's actually on his own. So I keep checking my phone to make sure if he gets in trouble, to call me or whatever, but yeah, everything's working out with that, so. Yeah, so I just wanted to update you on his progress.
He should be pleased from where he came from. Any questions?
Here's on.
Any questions? If there's no questions, is there a motion to accept the report as presented? Dr. First. So moved. Seconded by Kathy, second.
Yeah, I second.
Roll call, please.
Dr. Firster,
Yes.
Mrs. Salapata,
Yes.
Mr. Dubus.
Yes.
Mr. Simon,
Yes.
Mr. Messersmith.
Yes. Next up, this one is getting shorter every month because we're losing the grants. A
Okay.
grant coordinator report, please.
Yeah, thank you, Mr. Chairman. So the August report you would have received today because we couldn't get billing done enough time before we get the packets sent out. So there is, with the fiscal year ending July 31st and a lot of the budget cuts that happened, there's a lot of changes to grants right now. So we knew we lost the breast and cervical cancer community health worker grant, which we were aware of. And that was passed through money to Trumbull community action program anyway, so that did not affect our staff there. We did just recently find out Cribs for Kids that is ending here the end of next month. They're giving us an extension till the end of the year. What that amount is, I do not know yet. We should have the addendum to the contract signed by next board meeting to give that to you, but we will still have that program. Our Get Vaccinated Ohio grant, there was a huge delay in getting things started with waiting on the state budget. We did receive it, but they took away $3,480. And they did take one deliverable away, so there is less work with that amount of money. We also, as we all spoke, the last board meeting, we were aware of our public health emergency preparedness grant. They're only giving us that 72 or 78%, I can't remember right now, off the top of my head. 72% right now. So that cut is $3,567. We may get that. We won't know till the end of the year, if we receive that additional money. Services for homeless youth and homeless pregnant youth grant. That is also a contracted one with the Greater Warren Youngstown Urban League, so it is pass-through money. That one got cut $9,000, but we did finally receive that award. We did unfortunately lose the tobacco cessation grant due to funding cuts at the federal level and state level because their budget got cut in half. So with that, and due to the timing of some staff leaving, the resignations, Frank, Aaron, and I were able to figure out a plan to keep all employees on board. And the employee who was mainly in that grant, 90%, we've put her in other ones, that she's at 84% of her time is covered. So it's not too big of a hit to us. And you will notice on your August report, the new addition of the Trumbull County Adult Probation class. So what happened here was with our tobacco grant, our health educator was providing a tobacco cessation class to those in drug court and the adult probation. And when we lost the tobacco grant, we said we don't have the money to cover her time to do that. They just happened to get a new grant starting in July that they can pay and reimburse us for her time, mileage, and supplies because they still want this class offered to the individuals in the adult probation and drug court. So her time is being covered and once a month she will go and present there on top of the other grants that we have moved her into to help cover her time. And then lastly, I'll add, you'll see on the August report under the updates. I did meet with the Ohio Department of Health Grant Services Department. And I discussed potential grant opportunities during this turmoil, shall I say right now, in public health with funding. And they are working on a spreadsheet for us that I will get every couple of months with different funding streams and even more grant opportunities if I'm missing some and what their deadlines are so that we can hopefully build back up a lot of the grant funding that we lost with these budget cuts that happened at the state level and potentially with the federal. So with all that being said, please let me know if you have any questions.
Where was that meeting?
With ODA, it was a Zoom. They we set up a Zoom with our regional, in Reamer was on there with me and the grants.
Any other questions? If not, is there a motion to accept the report as presented?
So moved.
Second by
No second.
roll call?
Mr. Dubus?
Yes.
Mrs. Salapata? Yes. Dr. Firster?
Yes.
Mr. Simon?
Yes.
Mr. Messersmith?
Yes. The next one is the accreditation coordinators report.
Thank you, Mr. Chairman. I prepared a written report for the board. The only thing I would like to add is under reaccreditation work. From the time that I prepared this to the time that we are here. We did receive word from FAB that they finished our documentation review. And they sent back some revisions that we are currently working on. Those revisions were only allowed 45 days to strengthen those revisions that they're asking for. So they're accepting what we're giving, but they want to see something a bit better. So when we move on to the site visit, there won't be any questions. So we're working hard on all those revisions with that shortened time window. October the 10th is the deadline to get all those revisions in. And then after October the 10th, we should have a good idea of when they will actually do the virtual 2-day site visit. After that site visit, we'll receive our status, whether we remain accredited or not. With that being said, I'll take any questions if you guys have.
How severe were the revisions that they required?
They weren't severe. They're, in my opinion, they're asking us to drill down even further than what they initially asked, if that's a fair assessment, Frank, from what you've seen with me too. They want more explanation than what we've described, which is common. Some of it is a bit far reaching, but we can meet the standard. It's just the shortened window. We're moving at light speed to knock it off.
And yes, Dr. First. Short. Virtual site meeting.
Yeah, so the original accreditation process that you guys had when we first got accredited, they came to the health district
In
for
person.
in person for how many days was it? 2 days?
2.
2 days. They've now shortened it. It's now 2 virtual meetings, 4 hours each day. The first day they come in, they're gonna look at our foundational capabilities, which is like our community health assessment, strategic plan, quality improvement, things like that. Then the second day, they'll look at some of these smaller measurements that we have, and they'll want to discuss some of those as well. So I don't want to say it's in-depth as it was with accreditation. It's just a shorter time period. That's all.
Any other questions? Is there a motion to accept the report? First, we'll read the motion. Greg, did you second?
Yes, I'll second that.
Roll call, please.
Dr. Firster?
Yes.
Excuse me, Mr. Dubus?
Yes.
Mrs. Salapata? Yes. Mr. Simon?
Yes.
Mr. Messersmith?
Yes. The next one's a health educator report. It's not here and you have it, but I haven't had a chance to read it. Is there a motion to accept the report pending? So moved. Second? Second. Jack seconded. Roll call, please.
Dr. Firster?
Yes.
Mr. Simon?
Yes.
Mr. Dubus.
Yes.
Mrs. Salapatta.
Yes.
Mr. Messerschmidt.
Yeah. Board report, is there any board report? If not, any old business? You have something, Dr. Firster?
Yeah, not really a report. If I may.
You may.
Once in a while in my life, there are things that I've done that I regret. And,
Wait a minute, we're not, this is
Not
not a Catholic confession.
yeah, not often,
Keep us.
not often, but once in a while. A couple of months ago, we condemned a home as uninhabitable. And we did our job. But unfortunately, and I happened to drive by, this was on Route 5. And I happened to drop by one day to see the rubble after it was destroyed. And a fellow was in a truck and I said, gee, were you part of this demolition? He said, no, I'm from the state of Ohio. What do you call it? What old houses? Historical Society. And he said, it's a real shame that no one said anything about this house. Because it currently is one of the oldest houses, or would have been one of the oldest houses in northeastern Ohio. It was built in 1810. And he went on to tell me about the Underground Railroad and several other things. I just thought it was kind of a shame that the township of, where is that? That's
Braceville.
Braceville. Decided they wanted to raise it along with the owner. Because as this fellow said, there would have been grants out there to refurbish the place and make it nice. So I guess it's kind of a living, learning lesson. As a board member, I feel bad about it, even though we didn't have anything to do with its demolition. But I feel bad that I didn't do a little more investigation on what I was saying is uninhabitable and kind of giving the okay to be demolished.
Well, thinking, I mean, we have two sitting here, two township trustees, we have to rely on their recommendation when this comes in most cases.
I understand, and I
And
agree.
that,
But
truthfully,
it's
that
still-
house has been vacant for. I'm gonna guess 15 to 20 years with no windows in it.
I think you're right, because I've driven by it for the
I
last.
believe the true story of that was the son killed the dad and killed himself in the house. I think that was the
I
end of,
investigated that, yes.
I think that was the end of the family. So nobody's just ever had anything to do with it.
Right.
But yeah, what a beautiful structure it was.
Right.
20 years ago before they took the windows out. It's a pretty one, or was, now it's a rubble bomb.
Thank you, Dr. First, for bringing that to our attention, sure. Any other old business, new business? If not, moving on to new business. A is a salary adjustment invention for Tommy Lipcap, public health nurse number 2. Somebody has that.
That's mine. So Tommy's one of our nurses, so effective September 9th. Her date of hire, she is qualified to move from public health nurse 1 to public health nurse 2. Her job responsibilities will remain the same.
There a motion to that effect?
So,
Second.
Yeah, but.
Kathy seconded. Roll call, please.
Dr. Firster.
yes.
Mrs. Salapatta.
Yes.
Mr. Dubus.
Yes.
Mr. Simon.
Yes.
Mr. Messerschmidt.
Yes. Next one, the declaration of unfit for human habitation, 2291.
Yeah, that's me. Let me get the right spot. I'm not sure what I was
Donald,
daydreaming.
Rutherford Township.
Okay, yeah, 2291. So this one comes to us from Weathersfield. I can see the pictures there. So missing badly damaged ceiling tiles, water damage, solid waste, mold, gross unsanitary conditions. It's been clear that the electrical components are not working. So I would ask the board to adopt the motion as presented.
Is there a motion? Are you representing that house? No, sir, okay. So motion to that effect.
Anybody online?
So moved.
Kathy, did you second it? Is that what you were, okay. Roll call, please.
Dr. Firster,
Yes.
Mrs. Salapata,
Yes.
Mr. Dubus.
Yes.
Mr. Simon,
Yes.
Mr. Messersmith.
Yes, the next one is unfit for human habitation, 5152 Fisher Corner Road, Johnson Township, Jeffrey and Bennett Hornbeck. Oh, that's me. That's you, okay, sorry.
Okay, so 5152. So this one come to us from Johnson Township trustees. See the picture, so. Present solid waste, gross and sanitary condition, no electrical components, it's like got some ceiling tiles damaged. Leaves some moisture, so I'd ask the board to adopt the motion as presented.
Yes, sir, you have something you'd like to say about this?
It's seen better days,
Do you own it?
yes, sir.
You don't live there?
No, nobody can live there anymore. It's, too much water damage for the ceiling. Floors rotted it. I've worked on it for 20 years and just, I can't work on it anymore. Want it gone? Possible.
Okay,
So what we do here, Mr. Hornbeck, is that, if the board declares it unfit, it'll be kicked back to the township and you can work with them, but my guess is the township probably wants to take it down. Which sounds like you want to take it down as well, so I would be in communication with them. The role of the board here is to declare it unfit, and then it would be kicked back to the township at that point in time.
But have to go to a township meeting.
Yeah, just at least to find out what their plan is for it, yeah. Yeah, usually if you wanted to keep it, the advice is the same, okay, you have to talk to the township to see what they want you to do. But if you and the township are on the same page, I don't know how it works. If you go to them and say, take it down, I don't know all that, but. Our role is, yeah, it gives them the ability to go forward with their legal proceeding, I believe.
Yeah, my neighbor told me that somebody was there, and he thought it was me, get a hold of you guys
Oh, okay.
and have it tore down.
Yeah, that's fine, I mean, everything is, this is the. So far, you're in the right process, the next step is to talk to the township and see what their plans are. Okay,
roll call, please. Is there a motion to declare
I need a motion, yeah.
So moved.
second?
Second.
Roll call, please.
Mr. Dubus.
Yes.
Mrs. Salapata,
Yes.
Dr. Firster,
Yes.
Mr. Simon,
Yes.
Mr. Messersmith.
Yes. He's welcome to stay and leave if you have to go and mow your yard or something. You won't embarrass us by walking out of that.
No, I'm getting an education.
Oh,
I lost one broke into it, so.
school started yesterday or today. I hope you do
Broken
that.
now.
The education you get here and you might not get on the honor roll.
I'll look at the honor roll.
Okay, the next one. Declaration. Same road. Same. 4989 Fisher Corner Road, Joseph. I can't pronounce.
Hawley.
Hawley Junior.
yep,
That's your neighbor?
I've known the family forever. Lived on the same road 5 years, moved 5 times and never left.
so then this is similar, say come Johnson Township, pictures are up on the screen. Missing badly damaged seal tiles, present solid waste, mold, moisture. Gross unsanitary conditions, electric components were not working. I'd ask the board to adopt the motion as presented.
Is there a motion to that effect?
So moved.
Second? Second. Roll call, please.
Mrs. Salapata,
Yes.
Dr. Firster,
Yes.
Mr. Dubus.
Yes.
Mr. Simon,
Yes.
Mr. Messersmith.
Yes. Next one, declaration unfit, 7334 Ridge Road, Johnson Township, Thomas and Mary Boyd.
Okay, third time's a charm here from Johnson. You can see the pictures up there, gross unsanitary condition. No electrical components, there's note here, the inspector said the house was in collapse. So I'd ask the board to adopt the motion as presented.
Is there a motion to that effect?
So moved.
Second? Still looking at it, Greg?
Yeah, I'll second it.
Roll call, please.
Dr. Firster,
Yes.
Mr. Dugas.
Yes.
Mrs. Salapatta,
Yes.
Mr. Simon,
Yes.
Mr. Messersmith.
Yes. Oh, getting into the high class townships now. Declaration of unfit. 632 Underwood Drive, Liberty Township. Miss, I can't read.
Raheem Amrit, that's my guess.
Your neighbor, Jack. Turn,
Okay, so this is for Liberty zoning. Missing valleys, damaged ceiling tiles, present of solid waste, gross unsanitary condition. No electrical.
what's that in the yard? At the well?
Yeah, he took a picture of the well for whatever reason. So we make a notation on this, on the sheet, whether it's city water or well water, so that's this.
He doesn't show the picture of the outside of the house.
Yeah.
First, was there?
I would ask the board to adopt the motion as presented.
That's actually the water tower. Oh, fair enough.
That's by the water tower?
Isn't that?
Yeah, it's probably rules by the North Side Hospital, I would assume, right?
Underwood's off of Shannon Road.
Yeah,
Oh, okay, yeah, okay,
As soon as you turn on Shannon, it's on your left.
gotcha.
Doesn't look like it's an historical house. Is there a motion to a side? So moved. Seconded by
Second.
Jack. Roll call, please.
Mr. Dugas.
Yes.
Mr. Simon,
Yes.
Mrs. Salapatta,
Yes.
Dr. Firster,
Yes.
Mr. Messersmith.
Yes. The next item is the variance request, Philip McCoy Septic Tank Services on, Harrisville, Portage County.
Yeah, this is.
Talk to us about this one.
Okay, so this is, if you remember, we haven't had any of these in a year or so, but this is one where every year installers, haulers, service providers have to get CE, continuing education hours. You have to get it in the year prior to your registration. So to have a 2025 registration, he needed to get 6 hours in 2024, which he did not. So he's asking for a variance of that rule so he can work. With the understanding that he's gonna get the 2024, he's gonna get the ones he was supposed to get in 2024, as well as the ones he's supposed to get for 2026. A total of 12 in this calendar year in 2025. That make sense?
Did he apply before? Is it when it was on the?
I don't remember off the top of my head, but I don't believe so. I don't know how much work he does in the county. Do you guys use him, Ryan? No? I don't know how much work he does, but he did contact us that he had some jobs and then he realized, and I guess he forgot in Portage County as well. So there, yeah. So it might, I don't know, he might have not have been working and now he's working and he wants to.
I'll make a motion so we can open for discussion.
Is there a second?
What was the motion?
I made the motion for this, so we can open it up for discussion.
Second.
Any discussion?
Is this something we've done before? Give people
Yeah.
permission to work without their CE?
Yeah, so the way that the rules are written is you have to get your Cs before. Okay, so he either forgot, didn't do whatever. We have done it in the past.
I understand that we've done with that, the CE, what it means and what they have to, but if we do it. We allow him to continue working. What if he doesn't get it? Does that libel us in any way?
Well. If he doesn't get it. I mean, he would be, if you give him the variance to do it, and he doesn't fall through in the variance, he'd be in violation of that code. And then we would have to start down the path with telling him he can't operate in this count.
But technically, he's in violation of the code anyway, right?
He's in violation of the code anyway. Yeah, he's asking for a variance so he can work. Now, for all I know, he is working. He's trying to get quote unquote legitimate here. But to answer your question, if he doesn't do it. We could chase that down through that code section. Being that it's August already, he's probably gonna be turning in his stuff in for next year. I'd have to talk to the state to see if we can hold up a future registration and if he didn't comply with the earlier registration. But to answer, the short answer is, yeah, we would have to chase it.
But we've done it in the past. This isn't something.
Yeah, I'm not aware of anybody not.
this is actually the process that ODH recommends.
Yeah.
To those that did not achieve instead of just flat out denying their ability to work here, which would almost always be challenged in the court system that, that they come and receive a variance from the Board of Health. And then
Yeah,
it's,
we've
it's
done
up to Chris basically to oversee that,
yeah, I just am not.
make sure
aware
that
of
they do
anybody
comply
not
with this
following
variance.
through.
Well, I see you put a deadline at the end of the year on it.
Yeah, cause.
He has to have them by the end of the
Yeah,
year.
cause in essence, he didn't do what he didn't do in 2024 what he was supposed to do for 2025. And now he's under the gun to do what he's supposed to do in 2025 for 2026. So. And again, some of these guys are a little bit late to the table. If you go online, you can take these things, it's just gotta. You gotta make the effort.
Okay, thank you.
Any other questions? Roll call, please.
Mr. Simon,
Yes.
Dr. Firster,
Yes.
Mrs. Salpata,
Yes.
Mr. Dubus,
Yes.
Mr. Messersmith.
Yes. You have yours in order, Mr. Yoho?
What's that?
You have your things in order?
I hope so.
Okay, I just want to check it while you're here, so you could check on your way home.
I would imagine what happened was probably like the rest of us, everybody likes to go to the free trainings versus paying for the ones online, so.
Yeah.
There was just one a couple weeks ago, so probably he got his credits
Okay.
there.
The next item was a variance request for Darlin and Bailey Cesarni on
Yeah.
Niles Viana Road.
Yes. Right, so this is a variance request, they were putting in the step, well, I mean, I'll turn it over to Ryan, he's the installer on this one, so he can give you a little blow by blow here.
Start by the septic in for this home, it was sold as a house that had sewer and water. Come to find out, they do have a septic tank. It actually sits on the property of State Route 82. Doesn't sit on the homeowner's property. So in order to put a new septic here, we're gonna have to encroach the driveway and the road right.
Where's this?
Right on the corner of Niles, Diana and 82, you actually,
What was the north side, northeast corner, northwest?
if I'm coming from Warren, I would turn left on Niles, Diana, and you have to literally turn right into the driveway, because it's right at the.
It's, yeah,
It's on the north side of. Yeah, it's been, I noticed it was for sale.
What's that? Is this the?
Yeah.
Big construction?
No.
Aren't they trying to put a, oh, you said 82, not 11.
That's out.
you said sewer, you said there was sewer there?
That's how the house was sold.
Oh, then it
These
wasn't
people
true,
bought it thinking they
Okay.
had sewer water.
yeah.
Come out to find out when they had to pump their tank. they had-
Right, so what happened is in the trying to get the thing in, it's too close to the driveway and the right of way. So the homeowner applied for a variance from the isolation distances of 10 feet, correct?
Correct.
My neighbor girl looked at that house to buy it, and her dad says the traffic will drive you nuts.
Oh, that's
I can
true,
believe that.
yeah,
How could you need a variance for something that's already there?
he's putting in.
Putting in a new-
septic.
You're gonna put it in, you're gonna replace the one.
We're putting a new one in,
You don't know
but
where to go.
What was done in the '60s definitely doesn't meet today's code.
Okay.
So you don't have any problem doing this? Should, pretty straightforward.
Yeah.
Yeah.
So hopefully they never slide off the driveway.
We aren't gonna have a problem.
No, it's right beside the house, but the new tank is actually out by the road where the highway fence is. It's on the other side of the fence.
Is it in the right way?
It is.
It will be, yeah.
Don't forget,
Or
everybody's.
you don't have a blanket at the town, how old the house is. All right, I'll give you a call on the website.
This is Dewey.
Yeah.
Yeah. They went through.
How old is that they got put under the right of way? Had to be there for a long time.
Yeah, I'm not really sure how old the house was.
The neighbors aren't gonna complain like Mr. Tejada did, about 4
Only
months
if it's the
ago.
neighbor that drives the car up and down the road.
So you won't be in the right of way, you'll just be within the 10, is it?
Within
You're in
the
the
10
right,
feet.
so he's within the 10 feet, so you got the right of way, then this rule, so you have to be 10 feet from that, he's gonna be within that.
Which side of the fence you gonna be on?
The right side.
Okay.
Correct size.
As compared to the wrong.
Yeah.
Right on the edge.
You know?
Is there a, yes, Dr.
That's all I was gonna say.
Jackson, some motion.
Oh, you made the motion, Jack?
We're doing that for.
A second? Who?
Dr. Firster,
Roll call, please.
All I have a question is,
Whoops.
Bill, do you have any objection or any comments on this?
Absolutely not. I've been in the house. It's been around for a long time, so I know the older guy who passed away and
Yeah, as a trustee, I didn't know if you had any comment or not.
I don't, as long as it's not right there in the right away. The only thing that I can also comment on is tomorrow morning, 9 o'clock in Akron, I'm meeting with ODOT. And they're looking at to change that whole intersection there. They're probably gonna take out the center of that road. Seal it off. And they're going to develop what is called an R exchange. Go on YouTube, you can see it.
Right in, right out.
Yep. So it's, there's gonna be some changes there in the future.
They're gonna see it. Just want to make sure you didn't have an objection to us, a trustee.
They're doing Howland Wilson, but it took the virgin back.
Quite a big project. Okay, we had roll call, right?
Yeah.
Oh, would it have a roll call, please?
Mr. Simon,
Yes.
Dr. Firster,
Yes.
Mrs. Salatata,
Yes.
Mr. Dubus.
Yes.
Mr. Messersmith.
Yes. The next item is the authorization to enter into an agreement for engineering service. That you, Brian?
I could do it. So, yeah, it's just, so it's that time of year again. Where our, CNDD and our solid waste facilities will be trying to get, relicensed, so. Every year I ask about this time for the board to authorize Frank to enter, so we can get the, Emerald Environmental. So we usually use to get them to review our application.
Do we also need them to review the one in Gerard? Their transfer?
We need to renew that.
To review it.
Yeah, you'll review that, yeah.
Okay. So I just want, so they understand that there's more than one that they're looking at.
Oh, yeah, I'm sorry, yeah, there's High Valley Waste. Or, but they have this, so some of them have a, there's more than one. Without going to a long thing. Lafarge, even though they're not, even though they're closed, they're still gonna renew it, and they have a CNDD processing facility on site. So that's a dual one, and then Wolford's has a CNDD transfer processing, so that one's another one, Ohio Valley Waste. So there's 3 at the minimum.
And this 20,000 covers all that.
It did.
I think it did last year.
Yeah, it did, yeah, hopefully the prices don't go up.
Is that what the limit was we were making a motion on up to?
Yes, sir.
Is there a motion to that effect? Dr. Firster. Second,
I'll second.
roll call, please, if there's no other questions.
Dr. Firster.
Yes.
Mrs. Salatata,
Yes.
Mr. Dubus.
Yes.
Mr. Simon,
Yes.
Mr. Messersmith.
Yes. At this time, are there citizens' comments? Is there any online? We've got some citizens there. We'll just, anybody online?
No one online.
Yes, sir.
Yeah, I was under the understanding there was a meeting that I could get that trailer tore down. And what my concern are is, I lived on that road 60 years and a lot of the older people are dying off. We're having so many new young people with younger kids, 13, 14, 16, 18, you know, all ages. That's kind of why I wanted this trailer tore down. Does the township have a program that I can get this trailer tore down?
You'd have to ask them. I don't know. I know the land bank had money, but I don't know the process. I don't know if they still have money, but that's a
Wasn't
conversation.
this meeting about the state having money to tear that down?
No,
No.
we do nothing with demolition of all we do is, it's just a step along the way. One of the first steps they have to do is get it declared unfit.
Okay.
The Trumbull County Land Bank has the funds to, if they still exist, to demolish houses, so that they instructed all the townships, bring us all of your homes if you want us to consider demolished. Should have been brought to them a while ago, because when they asked that Phil about 2 years ago.
Yes.
For the townships to gather, they still may have some funds left to do it, but we're just a step along the way. We just determine unfit. Sometimes people can rehab it, bring it back to us to reverse that if they hook up the water, sewer, whatever, and clean it up, but we're just.
Okay.
Demolition, you gotta go to your
I
town and get,
understand. Fair enough.
they gave it to the land bank.
Another question, I don't know if I have the right round table here.
We know just about everything with this.
We need a four-way stop put there. There are so many people and I've sat and I pulled up to the Trumbull County Sheriff's and said, there's shade right there, you can sit there and do something. I go slow, I almost killed two kids if I wouldn't have been driving 20 miles an hour that run them in four-wheelers. There's been 8 people killed at that corner. There's been 3 people killed on the hill. One of them used to live in a house that we had. Is there any way to get a four-way stop there to maybe save lives?
If it's a county road, you have to see the county commissioners. And if it's a township road, you have to see the township.
Which road?
trustee.
I was calling him and
Which roads are there?
Fisher Corneth and Stoddard Hayes.
Those county roads, aren't they?
Are they?
No.
Ours is a county and then one's a state.
I would contact Gary Schaefer at the engineer's office, county engineer's office. He's the head deputy engineer.
Yeah, I've been trying to call, was it Joe Pentowski, the last for Trumbull County Engineers?
Who?
Joe or Jim Pentowski right up here, Trumbull County Engineers.
Well, that's the wrong engineer. You might want to. Wait a minute. I don't think there is a Joe. No, I would call Gary Schaefer. Oh, you're talking about, oh, yeah, no, you don't want to. Yeah, you need to go to the county engineer's office. I would call Gary Schaefer.
Very safe. Thank you, gentlemen. You're welcome. And ladies.
Mr. Peg, do you have any comments? It's your turn if you want to speak.
Another option for you, sir.
Yes, sir.
Have the Johnson Financial Trustees call me. Because I'm also president of Trumbull County Council of Governments. Yes, we're not doing a lot of, things right now as far as demolitions, but we've got a couple things in the work. Our current engineer doesn't believe he should do that work, but we have a couple other things to do. So ask them to call me.
Give them your card,
I'll give you
Phil.
a card.
Thank you very much.
Oh, yeah.
That's it.
Thanks. Thank you very much.
Anything else, Mr. Peg?
No.
You just want to be a visitor? It's not that hot out.
Well, join
in for there.
Then there's just invitation today and I didn't have nothing to do but sit around in meetings all day today, so.
Who invited you?
I did.
Oh,
Yeah.
No, I'm just kidding.
that's okay. Anybody can.
I said that.
I know.
I said that.
I know, I was on the mass mail.
There's no other. Joe, do you have to?
Perfect, thank you.
Okay, the next item is, going to adjourn for an executive session. Pending litigation, employment contracts and consideration of the appointment, employment or discipline of a public employee or official. Is there a motion to go into executive session? Seconded by who?
1.22.
Roll call?
Dr. Firster?
Yes.
Valentata? Yes. Mr. Dubus?
Yes.
Mr. Simon?
Yeah.
Mr. Messersmith?
Yeah.